Everybody. Hi, my name is Matthew Taylor. I'm a Vice President of Solutions here at NextGen Healthcare. And with me today is Dr. Jen Baldock. She is a certified pediatrician trained in the Navy, great experience there. And then afterwards at a clinic in Washington State, where she also served as the CMIO, and she brings with her experience at several other organizations, and she's really our clinical voice, which you'll hear from today for the product. Also with me today is Brian Sowers, one of our most experienced product managers in the organization, and experienced particularly in terms of just with solutions across the board. So you'll be hearing from him a lot today as well in terms of as we go through and showcase some of the capabilities today. And just a reminder, for those of you, this is a re-recording. We did this session originally back at the end of July, and then all of us had vacations and we took those and we're back and we're doing the re-record. So if this is a re-recording for you, there may be slight changes in terms of what we did, but the content is really the same. So today, really, we promised to, we want to talk about just some of the challenges that we see clinicians facing, just to kind of try and level set and make sure we're on the same page about, one, what you're seeing and how we're trying to solve for those problems. And then the pitch of this whole webinar really was to try and give you some practical ideas that, in theory, you can walk in the office on Monday and begin trying. And whether those are in your tool, and if you don't have those capabilities, be more than happy to talk to you about what NextGen might be able to do to support your practice in this way, and then kind of tie that off at the end with really just talking about the different ways that we see these capabilities delivering value, because at the end of the day, we really see our role as helping you achieve the outcomes that you're trying to achieve in your practice. So really quickly, just to kind of frame up the key challenges, you see these through here, this picture of Atlas sort of pushing the boulder. Majority of physicians report that they just don't have access to the information that they want to, or it remains challenging. So, that continues to be a theme that we hear across a variety of our conversations. When we survey physicians, likewise, 61% of them report that they feel like value-based care, adds to the administrative burden of physicians. So, they're doing their work, but oftentimes we hear about extra clicks, extra steps in the workflow to really, I got to do this to make sure I get credit for this work that I've already done elsewhere. And that's just a frustrator for clinicians. And then lastly, and this one, is continuing to get worse, is our latest survey reports that the average physician spends per patient 16 minutes and 14 seconds in the EHR per patient, which is longer than the average time that they spend in the visit with the patient. So obviously, I don't think many clinicians went to medical school to spend more time kind of as a data entry person. I think they did it to really, take care of patients and be with patients. So that's a challenge. So those really frame up how we think about just the solutions that we're trying to bring to really, again, support you to try and get the outcomes that you want in your practice. So when we did this the first time, we had a little survey and we asked the question, Brian, if you advance the slide, you'll see the question there, looking 5 years out, do you think the situation will improve, get worse, or remain the same? And for those that we had on the phone, the majority of the respondents, 57%, said that, they actually thought it was going to get better. So, I don't know. I think people were, it was a really positive group. I personally didn't expect it to be that way, but that's what the group said. And, as we talked through it with those group, I think some of them did see some of the tools are getting better. I think some people talked about just the interoperability and some of the things that CMS is doing by way of APIs and advancing data sharing and all that kind of stuff. So I would say personally, I still remain cautiously optimistic. I think time will tell how that goes, right, Dr. Jen?
Yeah, absolutely. I know. And I think it's really a matter of getting the right information at the right time.
Yeah,
It's kind of maybe a little bit different question, but
yeah,
yeah, I'm hoping it gets better. I hope we're part of that solution as we strive to get the right information to the right person at the right time,
yeah.
the right place.
All
That's
right,
part of it too.
Brian, you want to keep moving? So, just really quickly, this story about it. So this kind of picture, I just pulled it off the web. It reminds me of a hike I went on, and I tell this picture because I think it frames up well how we think about the information. So, went on this hike, and we had this individual with us, and they had their pack was much like this. In terms of very overloaded. And so if the objective was to all get to the same place at the same time, together, we started out on this hike and this individual was, remained at the back of the pack. So, what we figured out as a group was to say, well, if that's our objective, let's figure out how we remove as much of the burden from this individual as possible, take stuff out of their pack, share the load, then we can get there in person. So, they were really the constraint for getting us to where we wanted to go. And the reason why we use this as an example is, what we hear and talk about a lot with physicians is just, um, you know, information overload, lots of insights, all these things. In some cases, we get into some pretty heady conversations around, the R value of a particular insight or statistical, element. And at the end of the day, what we come back to is the constraint that clinicians and their team have is not necessarily the quality of the insight. It's important, but it's more how do they take action on it? And whether it's them or whether it's, another member of the care team, particularly as you think about trying to broaden and activate members outside of just the physician to do this work, could even include patients. How do you act on that insight? That's the constraint. So that's really framing up a lot of what you're going to see today and how we're really thinking that we've got great insights, whether they're coming from claims analysis, risk coding opportunities, Johns Hopkins, risk methods, like all sorts of different ways that we can generate insights. But what we're doing is we're really focusing on how do we, again, back to what Dr. Jen said, focus the right insight at the right point in the workflow to make it as easy as possible for the clinician to take work on that. And so with that, I will be quiet and turn it over to um, Dr. Jen so she can walk through how we're going to actually show you how we do that.
Absolutely. And you can see here on the slide, I love this. If you're unable to make use of an insight, that there's no value to it, right? If you have to go search for it, if there's just too much navigation around it, then it's just never going to happen. So we've got a couple ideas here to help you move forward with that. So Brian, let's go ahead and show it.
Oh, I guess um, we have the slide in terms of this. So this really frames up, really again, how we're looking at it. So we're continuing to improve the value and the access of those insights. And again, we're going to show you some ways that we present the insight at the point of workflow where you can take action on it. And again, like we talked about in terms of part of the big idea here is how we might be able to do this and actually activate as many people on the care team as possible to actually take action on that. So,
Yeah. So keeping these things in mind as we show you our ideas, I think would be a great plan.
yep.
Brian, let's just move right through to the demo.
Jump into the NextGen EHR. So pretend you're a nurse or provider, and you would need to take a look at a patient's chart. You can access the patient's chart in many different ways through the schedule, or you can bring the patient up here. And so let me go ahead and bring up Emily's chart. So as I bring up the patient's chart, again, you're used to seeing on the top of the screen the patient's information. On the right-hand side, you can see their encountered history, their notes, and things of that nature. But if you keep a look at the right-hand side, you notice this little traffic light up here. And what this is our insights ribbon, which automatically reached up to the population health solution and pulled down some really important information. So if I want, I can expand this out, but what the user can quickly see is gaps in care that they may be past, the ones that are near due, the ones that are failed, the ones that or excuse me, the ones that are past due, the ones that are failed. And also I can quickly see their risk levels from here. So I can see their ACG, their HCC, their ASCVD scores from here. So I can quickly see that information before I even treat or meet the patient. Also, what I can do is if I want more detailed information from our population health solution, I can launch the patient's profile from here. So when I select that, I can quickly jump up for that patient and view the gaps in care from here in more detail, some other information. Also, if I want to drill down on the patient's risk information, I can go ahead and see that here as well. So I can get more detailed information on the ACG information. So again, before I even meet and greet the patient, I can frame this out.
Right, and for those of you who aren't familiar with this system, the EHR is the NextGen Enterprise EHR, and there is this ribbon that overlies that. It goes with any EHR, so I think that's helpful to know. And then the difference here when we're launching into population health, that application has it's a multi-source data application. Right. So as Brian pointed out, there's a lot of information in there that may not even be present in the EHR that can help you learn about things you don't already know about the patient. Right. So there may be more to the story than you realize. But just to put that into context for people who aren't familiar with the screens that they're looking at today. So it's not only for the provider, right? So this Insights ribbon can any person on the care team can access that and take action on these items, which is terrific. And then not only the providers, right, Brian? And when we talk about it, we say, well, if this is used in a face-to-face encounter with the patient, why not flip that screen around and show the patient? Right? Why not share it with the patient? Show them where they've done well. Hey, we've got this much done already. Look at that, right? And maybe you have a couple things more to do, but let's take care of it and get everything done that needs to be done, whether it's screening or care that you need for a chronic condition.
So, Dr. J, did you say that the ribbon is available for other EHRs as well, not just NextGen? I just want to clarify
Yes.
that.
Yes, yes, not just NextGen Enterprise. As is, the whole population health application, right? It's really meant for any EHR.
Awesome.
Yeah, so that was an example of the population health information being available at the point of care in an EHR, right? So they don't have to log into Pop Health separately and then look around for that information. It's right there at the point of care. It is, one patient at a time, and you always have the patient in context in the EHR. Is the one that's in context in the Insights ribbon, and then again in population health. Now we're going to switch gears a little bit and show you how you can generate lists of patients from population health that can then be acted upon in the EHR. So let's go ahead and show Brian. We're going to go to metrics. And now we're in population health as opposed to being in the EHR. We can drill down on the metric itself, and we're going to actually go with a UDS metric of diabetes, hemoglobin A1C under poor control. Patients under poor control. We're also going to filter down on the provider, so we can go right to Dr. Jeff if we want to. I often pick Dr. Jeff, I don't know why, but that way we're really working specifically for a population taken care of by a specific provider. So in here, you can see when we move down to the bottom part of the screen, we've further stratified this metric so that you can see which patients of Dr. Jeff's have hemoglobin A1Cs within a certain range, or, they're past due for hemoglobin A1C, or we don't have a test from any one of our sources of data for those patients. So we're going to go ahead and click on the patients with no test. You can see that there's 11 of those patients. This brings us to the patient list functionality that we have here in population health. And what we can do with that, right? You'll see there that under the result, which is the 1, 2, 3, fourth column in, you can see there again that the result statement says no hemoglobin A1C result. So the action we want to take there is to order the test. Most times when we're ordering in an EHR, we have to order it one by one by one. But now we're going to export this list to the EHR, part of our system, right? Our platform. And then we're going to go to the other side. We'll go to the EHR and pick up that list and take action on it, right? So
Great.
yeah. Brian will
Great.
take it
Thanks,
from here.
Dr. Yeah, thanks, Dr. Jen. So pretend I'm the care manager or the nurse. I can go ahead and receive that list. We have an integration touch point for our NextGen clients called our Population Management Hub, or Hub for short. So I can come in here and I can go ahead and grab that report. So I can go ahead and manually import that list, and then it'll be available under my list. And you can see here's the A1C patients, those 11 patients that we sent over. So I can do many different things. I can do it on a patient level. I can do a select all patients. As Dr. Jen mentioned, that maybe we want to order a test for these patients. So I can come here and select my bulk orders. I can pre-set up radiology and lab tests here. So I can go ahead and select my HbA1c, pick my diagnosis information. And when I hit place for those selected 11 patients, it will place the order into the patient's chart. And if I so choose, I can actually, if I have the pertinent information, send it off to the vendor on the order. Also, if I want to reach out to the patient, another action I can take here is I can go ahead and send them a message. So I can come down here and select my outreach and come here and select for my pre-set up message for my A1C. Go ahead and grab the message I want. And I will look, when a message goes out, I'll look at the patient's preference that you captured in the demographic screen. It'll look how you have the message set up and send the message out in many different formats, the appropriate format, such as email, portal, secure messaging, texting, voicemail message, letter. We can send it out in many different formats. We can send it out in different languages. We can also include attachments for emails and portal messages. But the big thing is we can also document it in the chart. So if you go into the patient's clinical chart on the demographic screen, we have a communication log where you can see every correspondent that you sent out to the patient.
Absolutely. So very easy way. This is a couple minutes, right? This is finding that list of patients you want to act on in population health, shipping it over to the EHR, and leveraging that platform to then take the actions that you need on it. Less than 5 minutes. We've taken an action on 11 patients, and that's amazing, right? That we've not only done the order, but then we've also done the communication in the patient's preferred method. So very, very efficient way to address that. The next scenario that we'd like to share with you is patients not seen. And we're going to move here. We're still in Dr. Jeff's patient panel within population health. And now we've stratified his group of patients into when they were last seen. So we've got a group that's been seen between 3 and 6 months ago. The mustard colored one is between 6 months and a year ago. The pink patients have been seen between 1 and 2 years ago. And today we'll focus on those patients who were last seen more than 2 years ago. And so this is a concerning group of patients. I mean, these are the kind of patients that kept me up at night when I was in practice, right? I was very comfortable with the people I saw, but it was the people who I didn't see and who weren't in front of me. They weren't interacting with the healthcare system at all, who I kind of worried about. When were they going to show up in the ER, for instance? So we can go ahead and look at that list of 48 patients. And then that seems like an awful lot to act on at once. So one of the nice things about the tool is that you can bite off the number of patients that you can chew, right? So we're going to sort this group of 48 patients by their ACG risk score. And we're going to select the ones with the highest that we have in this population, which is a risk score of 3. And so we'll select all of those patients. I believe there are 8 today in the demo system. And we'll pretty much follow the same path that we did for the hemoglobin A1C no test patients, right? We're going to send these patients, this list, to the EHR, right, like we did before, and then we're going to act on them. At that point, I will turn it over to Brian and say, I've shipped that. You're ready.
Again, I'll go back into the NextGen EHR. So pretend I'm a nurse or a care manager. So I can come in here, go back into the hub. Again, I go through the same process where I can go ahead and import that list. And then here's the patients not seen. So here's those 8 patients that we sent over. Again, I can take action on one or all patients. So let me go ahead and select all patients. Maybe I want to send them a message like I did before. So I can come down here and select the canned message I've already set up. So let me go ahead and find that. Go ahead and select it. Again, when I hit send, it will send the message out to the patient in many different formats based on their preferred settings, if they would like to receive the message. I can also, if I want to call the patients, I can come here and go into the patient's chart from here. I can go into the telephone template and document for Brenda. I can also, while I have her on the phone, she's like, yeah, I'll come in. Let me go ahead and schedule an appointment so I can come here, pop into our scheduling search feature, schedule, search ahead, schedule the appointment, and take care of her, close that gap for her.
Right. And if you didn't want to act on it directly, you could also put a chart alert on there, right, Brian?
Yes, you can. Yeah, there's
Yeah.
so many different options down here,
Right.
and there's again, you could task it. You can put a chart alert in here. There's a
Exactly.
lot of many different things you can do.
A lot of different ways to take action on that same patient list. So again, another really efficient way to take action on the population health insights that we generate in population health. So those were the workflows that we wanted to show you, the best practices today.
That's awesome. You know, and what I love about that theme of each of those, whether it was pushing the insight through and making it available at the point of care, whether it was, allowing you to, take an action on the group of patients that, were meeting that particular quality metric or not, or the, patients not seen. I think all those are great examples of there's the insight there, but then it was also hopefully what you are able to see is it was really easy to take a lot of different types of actions, really quickly and not just patient by patient. So you saw there that example of, the ordering of 11 patients, at one time, pretty swiftly and communicating to them. If that was being done click by patient, that's a lot of clicks. Whereas Brian did that, for all 11 patients in a few clicks. So just to call out sort of the obvious if it wasn't clear. Next slide. And so as we think about this again, lots of different ways to measure value, but one of the questions that we're hearing more and more of is just, how do we measure outcomes? And so this is a slide that we put together, and this is something that we can certainly talk through in more detail real time if you'd like to, but this is a way to think about opportunity or ROI. So particularly for the last scenario, that Dr. Jen and Brian walked through where it was the patient not seen. So we've actually been working with a few of our clients specifically to help them understand the potential value of what those patients not seen might look like. So you can see here in terms of certain number of providers, their payer mix. So it's not all commercial, it's not all Medicare or Medicaid. It's a mix of those, and that can be adjusted. And then we just took some average, reimbursements for each of those and just said, hey, well, if they can get those patients, for example, that they haven't seen in 2 years, and they can get some of those patients in and maybe close some of those gaps, here's what that potential revenue for, the practice looks like. And that's not the primary motivation, but again, it speaks to the value that is potentially there. So, ways to think about using this are, we've got some more sophisticated analysis in terms of what are the top 10 conditions that we likely see. We can change some of the payer mix. You can also change how aggressive you want to be in terms of how much of those gaps you think you can close. But, one of the clients we've worked with, they've actually thought about using this as a way to potentially even make the case to say, well, given the opportunity that we have, it actually makes sense for us to bring somebody else on board, whether it's a physician or advanced practitioner. That there's opportunity here that we can do a better job of taking care of our patients. So again, hopefully this plants some seeds to ways to think about this, but certainly we can speak more to this if there's a desire. Next slide. And then, as we think about delivering value, certainly the outcomes on the previous page is important, but also, I think these examples or quotes from Dr. Jansen here. So he's a long-time client with us, excellent advocate, certainly for what we're doing, but also for population health, really, in his respective area, and just really a great leader in all respects. And so you can see here some of the quotes that he's had, but I think these three things really talk about where we see value and the outcomes are important. So, really increasing patient engagement. So you saw there initially on the first example, that tool at the point of care, which the NextGen Insights ribbon, that's a tool that Dr. Jansen in a previous webinar we recorded, he's got some neat examples on how he's used that with patients to actually help activate them more into just taking ownership over their health. We also see in terms of just some of the capabilities, whether it was in the application or in the HR, in terms of just making sure that people are practicing at the top of their license. So rather than having clinicians and other people sort of hunt and peck for stuff, they're using the tools that's really helping maximize what they're doing. And then the last one, probably one of the quotes that we like the best is, the only way your practice is going to get an increase in revenue is by engaging with population health. So said another way, no money, no mission, right? And so most clinicians that I know, they don't necessarily go into practice with, the dollar signs as the primary motivator. Usually it's something much different. However, making sure that you're able to fund the practice, fund the things that you need to do is an important and necessary step. And as value-based care continues to change the landscape, in many ways, you've got to get more sophisticated at being able to keep up with the different measurement programs that you're being held accountable to, just to get the basic reimbursement back so that you can do the things in the practice that you want and need to do. Next slide. So Dr. Jen, I'll turn it over to you. Can I bring it home?
Oh, sure. Actually, I was just thinking you just said it so beautifully. I was going to say, I don't think I could have said all that better myself. So certainly we've talked today about the NextGen Insight ribbon. I think it is an amazing tool to bring population health into your everyday workflow, trying to make sure that you don't have to log in somewhere else to find these insights about a patient. Why not make it easy for providers and the whole healthcare team to take care of the patient? So certainly this insights ribbon is great, delivers these precise insights that we've been talking about. And what that means is that we've taken multi-source data into population health, run it through the metrics and given you those gaps in care, and worked very carefully to validate that data and provide you with those actionable gaps. It's delivered at the point of care. Really, you saw what Brian had to do to open it up. It's literally, you can choose to open it up or not. You can see if there's something there to be seen or not, which is what I like with the traffic light approach. And then, yeah, it's essentially the fastest way we can think of to get that information into your hands that matters for that patient on that day. If you have 2 minutes to spend on a patient, try to pick one or two of those things and act on them.
So if you'd like to learn more, please reach out to James Duncan, jduncan@nextgen.com. Be happy to engage in terms of what that might look like, whether you're trying to conceptually apply what you've heard here in terms of with your systems, whether you want to explore other options, but more than happy to talk to you in greater detail. So thank you for your time and attention today, and thank you.